68-year-old gentleman was referred to us for the favor of evaluation of a suspected pancreatic head lesion. On EUS, you can see irregular hypoechoic lesion in the pancreatic head, measuring 3 centimeter by 3 centimeters, and this patient has a metal stent. You can see the metal stent on EUS. So patient was referred to us for tissue diagnosis because patient has undergone ERCP and metal stent placement elsewhere without tissue diagnosis. You can see the pancreatic body and the pancreatic tail duct, you can see very well, and during evaluation you can see that proper ductal evaluation is there. There is a sort of a hint that there is not much of dilatation of pancreatic duct in the neck and the body, and there is definite prominence though. There is a lesion in the area of the lower bile duct. It's important to always evaluate the left lobe of liver in order to not miss any metastatic lesion. EUS is now considered as one of the most foremost modalities to be used, and here you can see extremely small hypoechoic lesion in the left lobe of liver. You can see how inconspicuous lesion is that. Where the arrow is, you'll see we are marking it, and this is definitely a small 7 millimeter by 5 millimeter lesion in the left lobe. This kind of imaging allows a very accurate assessment of preoperative staging when PET CT scan and conventional imaging modalities fail to pick up such small lesions. So anyway, this patient has a metal stent. Patient was sent to us for overall evaluation and tissue diagnosis. We have seen a small lesion in the left lobe of liver, and therefore in this particular video we are focusing how EUS guided FNA can be performed from the suspicious left lobe liver lesion. And you can see here we have identified that lesion which was seen earlier on radial at of course 12 megahertz, and now you see the needle right in the center of the lesion. Very gentle maneuvering can yield effective tissue diagnostic material, and this patient did have metastatic neuroendocrine tumor in the liver. So EUS FNA has a role in liver metastasis.